Thanks for staying with us. So joining us now is the Commissioner, Honorary Commissioner for Health, Cross River State, Dr. Betta Edu. Good morning, madam. Are you there?
Yes, good morning, and it's nice to be with you.
Yes, good to have you on the show today. Right, so your principal, the executive governor of Cross River State, has been in the news lately. He's been quite controversial because of his seemingly different way of handling this COVID-19 approach. It seems as though the governor is focused more on saying no mask, no movement in his state and getting everybody back to work. Could you tell us more about that, please?
Thank you very much. And like I said, I'm happy to speak with you this morning. For us in Cross River State, our own #1 strategy is prevention. So we want to see that we can prevent the coronavirus from coming into our state. We can prevent an outbreak in our state. And from the beginning, we have been working hard on it. My governor had always said, it's better for you to prevent than to cure. It's better for you to concentrate on ensuring that the virus doesn't come into the state than to put all your focus on planning on how to manage cases. So that has been our approach. As early as January, we started the EOC, that's the Emergency Operations Center. And from that, we went into sensitization of communities. We were one of the first states in Nigeria to start screening people who were coming in through our borders. We were the states that started the no mask, no movement. Yep. At that point where we started the no mask, no movement, I'm sure you know very well, Nigeria said what we were saying was wrong, and that was not what was supposed to be. Masks will not provide any form of protection for anyone. But we're glad that today the whole nation is back to the same sport, and everybody agrees that the masks will provide protection for people if everyone uses the mask correctly. So these policies are policies that the government of Cross River State has been rolling out early enough, and we've continued to hammer on them. At least in Cross River State, when you go through the metropolis, you can have close to 95% compliance.
Right.
The House of Assembly passed a bill which was signed into law, and it carries very heavy sanctions for persons who are not using their masks.
Right. Okay, let me get it. Go ahead, ma'am.
Yeah, so Cross River definitely needs to be commended for their forward-thinking approach in some areas concerning COVID. But one thing that worries me is that I think on May 4th, the governor is saying all civil servants should go to work. So even though you have adopted the mask up, which is commendable, I don't understand why it's not so important. Social distancing doesn't seem to be so important to the state. Does the mask, in your opinion, your governor's opinion, enough and, to stop the spread?
So my governor is being practical about this. In the African context, in the African society, it's very, very difficult for us to achieve social distancing. I'm sure you saw the pictures coming in from Lagos and the videos made by people. As soon as the lockdown was open, people were back on the streets. You saw the banks filled with human beings. The bus stops, the same thing. You go to the market area, it's the same thing. Nobody understands what 2 meters apart means. No one is keeping it. It's our African culture to always come close to people. I've had personal issues with people because I had to say, please step back a bit. You're too close to me. And then they feel, oh, they're not welcomed around you. And why would you ask them to step back? That was not nice. That was not courteous and all of that. So it's our African culture to be communal, kind of, to be together, to try to relate, hold hands and all of that. And so what my governor is not against social distancing, but all he's saying in simple terms is that it's very, very, very difficult to achieve that. So why not you tell these people to use a mask always, so that if you can protect yourself, they too are protected. The virus will find it difficult to go from one person to the other. That's the situation. For us, we are not asking that civil servants should come back and hold large gatherings or meetings. No event holds in my state as we speak. All you're supposed to do is to come back, get to the front of your office, get screened, wash your hands using the water and soap that has been provided, take the hand sanitizer, go into your office, do your work alone or at most with 1 or 2 persons, after which you should go back home directly. So you're not even allowed to go from work, sit out with friends or stuffs like that.
A group in Cross River State has claimed that there is evidence that there's coronavirus in the state. But so far, testings have not been done, contact tracing has not been done. And they're actually appealing to the president to intervene in the matter. Do you think that, in all honesty, there is no coronavirus? And is it a possibility that because you're not testing, you really do not have the data to show if there's coronavirus or not?
So I want to put that very clear. Cross River State is testing. I think the last samples came in not too long ago. Okay. Cross River State, we have been sending in samples to the reference lab in Irua or in Ebonyi, okay, where they test and they send the results back to us as negative. We're not the ones who do the test here in the state. We've been appealing for a testing center in the state so that it's less cumbersome for us. Okay. We have to spend over 200,000 every time we have staff travel with sample all the way to Irua and back. Right. And that's how expensive it is for us. The sample kits which were given to us are limited. Like I said very clearly, we've been asking for more sample kits. We are yet to receive any consignment of sample kits. We have disease officers, surveillance officers, and notification officers in the field, in all the local government areas. And persons who meet the criteria that has been drawn up by NCDC, their samples are collected, we send them to the lab, they test them, and we get them back. Right. With a limited number of sample kits, like 50, there's so much you can do. And these sample kits, we can't use the swab sticks which we have available here. Right. These sample kits are the ones that were sent to us by NCDC. So right, these are the challenges we face. Okay. But we are testing, and we have gotten results and evidence to show for it.
We read in the papers that your governor sent back Almajiris from the north. Tell us about that. How are they intercepted?
So really, one of the things which my government has been doing, the government of His Excellency Senator Professor Ben Ayade and my governor has been doing, is to ensure that our borders are manned by both commissioners, special advisors, health workers who do screening for essential service, and then, of course, the security agencies. They stay there 24 hours. The chiefs and vigilantes are also part of the team that we pay every single day to be at the border. So while they were at the border a couple of days ago, I think this has happened 3 times now. The first time, 5 trucks came very late in the night, around 12:30 a.m., and they were intercepted. We had mostly children, some women, and some men. And then I think 2 days later, another set of 2 trucks arrived. The same thing. One of the trucks had foodstuffs in front of it and then humans behind it. So what we tell them to do is to thoroughly search every truck that is going through. And they were searched, and we saw that they were carrying people. We had to send all of them back. 2 nights ago, the same thing occurred again. Another 2 trucks filled with Almajiris were trying to make their way into the state, and they said they were coming from Kano. And we said they had to go back with the people back to Kano State. Wow. Yeah, so your governor
has been warming his way to our hearts, because we saw him on the field with the people. Yes. He said that he was hiring 8,000 youth and paying them 30,000 naira each. Initially, we were wondering, how is that going to happen? But when we saw him in the field, because I know that your state obviously is known for cocoa production and exploitation. Yes. Tell us about that. How does he plan to pay these people 30,000 naira?
Okay, so basically for us, my governor has said, while we're protecting lives, we must be able to protect livelihood. If not, we're going to degenerate into a society that would be catastrophic for everyone to live in. And so he has tried to say, as part of the palliatives that will be going out, of course, the rice, the yams, and all of that will go to the elderly and those who are vulnerable in society. And then, of course, for the young people who still have energy, he said he wants to harness that energy and put it to good use. So 8,000 workers have been employed. 1,000 have been sent into the garment factory to produce nose masks like what I'm using. We have given out over 1.5 million to our citizens, and he has sent some to neighboring states, Benue and other states, Kano and the rest of them. At the same time, the governor has also taken another 1,000 into the agricultural sector. They are going to the farms and then they will produce. He hopes to pay them directly from the state coffers. And well, we call it the Ayade magic. I don't know the details of where the money comes from, but know that he
Okay, let me pause you. Let me
month.
pause you for a second. We're going to go on a quick break. We'll come back and continue this conversation. Stay with us. We'll be right back. Thanks for staying with us. We still have the Commissioner for Health, Cross River State, Dr. Betta Edu. Madam, are you still there?
Yes, I'm still here. Thank you.
Go ahead.
Yeah, so your government is taking a leap right now because this is the time that other people are sitting back to see if they are going to like lay off or have a salary cut, and yet he's employing people at this time. So I want to ask, because I know that he's been requesting for funds to support in this fight for COVID-19. Has he gotten any form of support from the federal government, from any other international body?
Okay, thank you very much. I think basically we've not gotten any support yet from the federal government. We're hopeful that the federal government will come forward with a support for us, some funds to support the fight in Cross River State. Okay. Most of the funds, at least 99% of the funds that have been spent thus far, is from the state government. We've had 2 banks come up to support us, and then we've had some individuals, I think just one individual, support us with funds. The rest of it has been basically items from some private organizations. Lafarge supported us with an ambulance. Some organizations have given rice, pasta, and a few things, and that's all the support we've had so far as a state. We're also working with some NGOs. USAID is supporting us for the training of 400 health workers in the state, and we're looking forward to some immediate support from the UN too. Okay. So this is just all the support we've had.
Right, go ahead, Mary.
Okay, I have 2 questions. One that really concerns me is, since Cross River is opening up again and civil servants are able to go back, what does that mean for schools and children in your state? That's one. Secondly, there's a viral video, of course.
Sorry, I didn't get that question.
Schools. Cross River is opening up again. So social distancing, as you explained before, is not something you feel that the state can enforce because of our communal way of living. And so my question is, what happens with schools then and the children going back to school in Cross River State? Does that mean it's open? You know, that's one. Did you get that? Then secondly...
Yes, I did.
Okay, then secondly, of course, there's a viral video of the governor talking about the scientific way to handle this, and vaccine is not the answer, and the way that COVID is being tested right now is not the best way. Do you have like more information, since you have led the way basically in how to handle this? Do you have more information concerning vaccine or no vaccine? Especially now that globally, that's what we're talking about. Okay,
so first and foremost, we in our state, we also preach social distancing. We're not against it. We're only giving alternatives, understanding our context. Secondly, we are not opening our schools yet. Okay. Remember that our children need to stay on until we are very sure that we no longer have cases in Nigeria, and then they are free to come back to school. So we're not thinking of opening schools anytime soon. We're working with the federal government directives as it concerns that, and we have to just keep watching, praying that all of this is resolved soon. I was happy to see that the number of new cases are gradually beginning to drop, which of course is very encouraging. We believe that too soon the children will be back to school. For now, we encourage the e-learning, and private and public schools in our state have been asked to begin to engage with children through the e-learning methods on Team, on Zoom, and the rest of it, and it's been very effective for them right now.
We have to let you go at this.
For the issue of the vaccines, we have called on the federal government to come and support Cross River State to set up a vaccine manufacturing and research factory in our state. And one of the things that my governor believes that the professors and the academias in Nigeria who have not been given the right environment should be doing at this time is to work on ways in which we can find vaccines to provide solutions to all of this. If we had a vaccine, then children can go to school because we'll give them the vaccine and have them go to school. As we speak, research should be ongoing right now in Nigeria to find out if the antibodies can be isolated and that they can be used for vaccines, to find out if being infected once will give you immunity against the disease, and several other things. And so we are calling on the federal government to come in and help us. Let's start researching.
We have to let you go, but on a lighter note, some of us chocolate lovers would love to see Cross River State get involved in production of chocolate. Since cocoa, you guys are producing, you're growing cocoa in your state. So it would be a good thing to have chocolates from Cross River. Should we be looking forward to something like that soon?
I love chocolates just like you, so I'll be the first customer and then you'll be second. Thank you so much.
All right, looking forward. Have a lovely day. Thanks for joining us. Such a pleasure speaking.
Thank you so much for having me.
Yeah, we'll be speaking with the Honorable Commissioner for Health, Cross River State, Dr. Betta Edu. We're going to go on a break. When we come back, we'll move on to other topics. Stay with us. We'll be right back.